There are several women out there who have failed to conceive just because their periods are irregular. Their periods change. A woman will tell you, I had periods on 6th, and then this time I am having them on 15th. Those are irregular periods, and they are causing a big percentage of women not to conceive, not to get pregnant. In this video, we would like to know what causes irregular periods, how we can treat them so that a woman can have a happy life and conceive.
Ask Dr. Othman on Sawa Wall.
Hello my lovely viewers, welcome to Ask Dr. Othman YouTube channel, a channel where you learn medicine at the comfort of your living room. And I told you, if you'd like to get in touch with me, to have a private chat with me, go to my website www.drothman.com and book an appointment. We shall be there, we shall talk together, we shall discuss your issue and find a solution to your issue. Today I'm talking about irregular menstrual cycles, or what we call irregular periods. Someone can ask themselves why we are talking about this. This is a very important topic, as much as there are very many questions in my inbox concerning this, but it's a very important item to talk about. Why? Because there are several women out there who have failed to conceive just because they have irregular menstrual cycles or they have irregular periods. Secondly, which is also very vital, is that many women have gotten ashamed. Many women have been embarrassed in public just because they cannot know that today I'm going to have my menstruation, I'm going to have my periods. Because usually when a woman is aware that tomorrow I'm having my periods, yet I have a presentation, they are going to prepare themselves. It's going to pad herself, it's going to prepare herself so that even if she starts her menses while doing a presentation, while in a conference, while in a class as a teacher is teaching students, is in class, they are able to control themselves, have their periods in peace, and nothing like an embarrassment. But for a woman who has irregular cycles, because irregular cycles, this is when a woman has changing periods. This time is having periods on the 28th, the following month is having periods on 30th, and another month is having periods on the 2nd. When we come to the length of the menstrual cycle, this month it's 28 days, the other month it's 30. Another month it's 28. So it's unpredictable. A woman cannot understand when they are going to have their periods, so that they plan for them, so that they are able to encounter whatever happens. Now, this is the gist of the matter. This is the main reason as to why we must discuss this. And whoever watches this video, please make sure that you teach your friend so that they too don't get embarrassed. And if it's your very first time to watch this channel, please don't forget to subscribe, press the notification bell in order to be notified of any important video we upload. Now, what causes irregular cycles? What causes irregular menstruation? We must understand this factor. Let's understand how menstruation occurs. For menstruation to occur, there must be 3 items in place, or 3 important people. There are 3 important people involved in this business of menstruation. The first one is called the brain. The brain, it passes through its main actors, the pituitary gland and the hypothalamus. The brain is very important in this because it produces, or it causes release of hormones called the luteinizing hormone and then the follicle-stimulating hormone. I told you the brain uses the pituitary gland and then the hypothalamus to produce or to cause the release of the follicle-stimulating hormone and the luteinizing hormone. It is these hormones that prepare the egg. The follicle-stimulating hormone will make sure that the egg matures, and then the luteinizing hormone will make sure that the egg travels or to cause ovulation. This is done by the brain. Therefore, for menstruation to occur, the brain should be okay. The pituitary gland should be okay. The hypothalamus should be okay. Any problem with that, we shall have irregular cycles. Now, number 2 is the ovary. I told you that the ovary it's the sac that contains the eggs. It contains the ovules. Now, this sac you are seeing, it doesn't only contain the eggs, but it also causes the release of a hormone called progesterone and then estrogen. These hormones are also very important in the process of menstruation. Now, the last human being there is called the cervix. The cervix, I told you, it's that part, it's like the door to the uterus. Now, once blood is formed, it is the cervix to open and cause the release or flow of this blood. Therefore, if there is any problem, on any of those structures we've talked about, we shall have irregular menstruation. Now, the first problem will be hormonal imbalance. Hormonal imbalance. Because we've seen that these activities are coordinated by hormones: luteinizing hormone, follicle stimulating hormone, progesterone, and estrogen. Now, if there is hormonal imbalance whereby one hormone is not in the regular amount, it's not in the right amounts it's supposed to be, either it's too high or it's very low, then we shall have irregular menstruation. And the main hormone that usually brings irregular menstruation is the progesterone. It is this progesterone, though even other hormones can cause irregular menstruation. Now, there are conditions which are normal to the body, but again are going to cause irregular menstruation. For example, puberty. When a girl is just beginning her menstruation, has reached the puberty stage, there is that hormonal interplay. There are a lot of hormonal fluctuations, and because of those hormonal fluctuations, the girl may not have regular menstruation. However, because I've told you this is normal, for puberty it's normal, however, it stabilizes as the period goes on. Within a year or 2 years, it will stabilize, and then the girl will have normal menstruation. Therefore, if you have a girl and she's telling you, or you've realized that her menstruation is irregular, just talk to them, counsel them. This will normalize as time goes on. So during puberty, that can occur. Another normal area is the perimenopause. That is like a year close to your menopause. Menopause is a period whereby a woman can no longer menstruate. And this happens usually from 40 years and above. Now, there are some women who will get these irregular menstrual cycles. Actually, not some, but most women will get irregular menstruations during when they are close or when they are about to reach their menopause. And this is also normal. However, it still disturbs women. Now, what is abnormal? What is abnormal are the hormonal contraceptive pills or hormonal contraceptive methods of family planning. Now, there are some women whom we put, or there are some women who are using hormonal contraceptions or hormonal contraceptives. For example, the birth control pills, the jadels, the implants, and then even some people use hormonal IUDs. Now, when a woman is using hormonal contraceptives, like I've told you, the implant, the injection, the monthly injection, or what we call the Depo-Provera, the birth control pills, those implants or those contraceptives can cause hormonal changes, can cause hormonal fluctuations and lead to irregular menstrual cycles. That's why when we are teaching about these family planning methods or these contraceptive methods, we usually tell you that this method can cause irregular menstruation, this method can cause dysmenorrhea, this method can cause menorrhagia, or can cause heavy bleeding. So contraceptives can cause irregular menstrual cycles. Now, what else can cause irregular menstrual cycles is the brain tumors. Because I told you that the brain is very important in this. It is the one through the pituitary gland, and then the hypothalamus. It causes the release of the luteinizing hormone and then the follicle stimulating hormone. Now, if you have a brain tumor, for example, you have a pituitary tumor or a hypothalamus tumor, what is going to happen is unbelievable. That either this pituitary gland or the hypothalamus is going to cause excessive release of follicle stimulating hormone or excessive release of luteinizing hormone. And when there is excessive release of luteinizing hormone and follicle stimulating hormone, it is going to cause a negative feedback on the release of the estrogen and progesterone, and therefore you will not have regular menstruation. Therefore, tumors or brain diseases, especially that affect the pituitary gland and the hypothalamus, can cause irregular menstrual cycles. What else can cause is the ovarian diseases. The ovarian diseases. We have things like the tumors or the masses, cancers of the ovary can cause irregular menstrual cycle. Because we said that It is the ovary that causes release of estrogen and progesterone. Therefore, if the ovary gets any problem, any disease, a tumor, then issues will arise. There is also a disease called uveitis, inflammation of the ovary. If that happens, then you are likely to have irregular menstrual cycles. What else can cause? The uterine diseases. Uterine diseases, because we said that this blood comes from the uterus. It's the endometrium that is shed off. Now, if you have a problem, a cancer, endometritis, you have endometriosis, and so on, then you may have a problem with your periods and you'll have irregular periods. Now, another issue here is cervical. Because we said that the cervix is also very important. It provides an opening for blood to flow out. Now, if the cervix has an issue, it has a tumor, there is cervicitis, you may also have irregular periods. Then we also have the PIDs, pelvic inflammatory diseases, sexually transmitted infections. Pelvic inflammatory diseases, sexually transmitted infections can also cause irregular menstrual cycles. Now, something else that causes irregular menstrual cycles are the polycystic ovarian syndrome. I talked about polycystic ovarian syndrome one time here. Actually, you can check one of my videos when we were talking about polycystic ovarian syndrome. And we said that one of the signs and symptoms of polycystic ovarian syndrome is all are the irregular menstrual cycles. Another issue here is endometriosis. We also talked about endometriosis in one of my videos. And I said that endometriosis is the implantation of the uterus, of the uterine lining somewhere else. Okay? The implantation of the uterus somewhere else. You find that the endometrial tissue is implanting somewhere else, is implanting in the cervix, it's implanting outside the uterus, it's implanting in the tubes, it's implanting, it can even implant itself in the gut or in the intestines, and that is what we call endometriosis. That can also cause irregular menstrual cycles. Also, weight loss, excessive weight loss. We're not talking about just a simple weight loss, but there are some people who excessively lose weight. There are some people who excessively gain weight. So if you have excessive weight loss, excessive weight gain, you can have changes or irregularity in your menstrual cycles. And also lastly, as the cause of irregular menstrual cycles is the stress. And the stress we're talking about are the emotional stress. Depression. Someone is depressed. Someone has issues at home, family issues. You have job issues. You've lost a job. You have very many. Those psychological or stressful acts can cause irregular cycles. What are the effects? If someone has irregular menstrual cycles, what is going to happen to them? Because at the end of the day, why should we even be talking about irregular menstrual cycles? We are talking about them because irregular menstrual cycles can cause infertility. I am telling you, I have met many women who are infertile, and the issue is irregular menstrual cycle. Because first of all, for women who have even long distance relationships, they have to plan to know when are my fertile days, when is my ovulation, so that they can meet their spouses to conceive. Now, if the menstrual cycle is irregular, it really becomes so hard for these human beings to have their fertile days and safe days well clear so that they can conceive. And also, when these people have irregular menstrual cycles, because most of the irregular menstrual cycles are affected or are sponsored by hormonal imbalance, infertility is setting in. So something else, or another effect, or the complication of this irregular menstrual cycle is that we say polycystic ovarian syndrome is one of the causes of irregular menstrual cycles. However, irregular menstrual cycles themselves can also cause polycystic ovarian syndrome. And when a woman gets polycystic ovarian syndrome, it's again adding an insult or salt to a wound. Now, another issue, what else can be caused by irregular menstrual cycle is the endometriosis. We said that endometriosis can cause irregular menstrual cycles, but also irregular menstrual cycles, on the other hand, can cause endometriosis. Because look at this pattern. There is bleeding almost irregularly. So there is shedding of the endometrium. There is shedding of the endometrium irregularly and recklessly. Therefore, the endometrium can find itself being implanted somewhere else and then causes endometriosis. Another issue here is the cervix uterine cancer, cervical uterine cancers. Cervical, all the cancers of the uterus, cancers of the cervix can be caused by the irregular menstrual cycles. Why? Because usually the reason as to why cancers occur is because of excessive multiplication of cells in that area. Now, because there is bleeding every time, there is shedding of the endometrium every time the cervix is being disturbed, it is being injured from left and right, my friend, this can lead, or it can be a precursor for cancers. Now, if we know the causes, we are already aware of the causes of irregular menstrual cycles, can't we treat them? Because at the end of the day, what we need is for woman to be free, is for woman to have a normal menstrual cycle, a regular one. And again, if the cause cannot be treated, let us know, and we just learn, we just cancel ourselves to stay or to be with it. However, if it's your very first time to watch this video or to watch this channel, please don't forget to subscribe and also press the notification bell in order to be notified of any important video we upload. And I told you, if you'd like to get in touch with me to have a private chat, a private consultation, go to my website, www.drothman.com. Book an appointment, we shall be there, we shall talk. Now, what is the treatment? The treatment of irregular menstrual periods is number one, to do tests. Please first do investigations. Do tests to identify the cause. So treatment will depend on the cause. There is no treatment for irregular periods. I have seen women, someone comes, tells you, I have irregular periods, I went to the hospital and the doctor gave me some pills. I mean, what are those pills for? This is a very important information, because there are several causes of irregularity. Let us first identify the cause and then treat according to the cause. So what you're going to do, you're going to do several blood tests. And one of the tests which are supposed to be done from blood is the fertility hormonal assay. Fertility hormonal assay. Check for fertility hormones. Check the levels of estrogen, check the levels of progesterone, check the levels of luteinizing hormone, follicle-stimulating hormone, and prolactin. Identify their levels and know where the problem is. If you find that the problem is with progesterone, there are low levels of progesterone, then you're going to take pills which contain progesterone. You're going to take progesterone injections. So we treat this according to the cause. Do a scan. Do an ultrasound scan, do a CT scan, identify masses. We may be dealing with a tumor, we may be dealing with a cancer. Do a brain CT scan, do those tests, do an abdominal ultrasound scan. You may find that we are dealing with fibroids. We have tumors in the uterus. We have tumors in the ovary. We have whatever, the arthritis and so on. So do tests, do x-rays, HSG x-ray. This will be able to also show us the different, if there are tumors and so on. So before you attempt to get any medicine, and my fellow doctors, before you attempt to give this person medicines, please do investigate, identify the cause, and then we treat. So I've said, if it's hormonal imbalance, if there is a hormone which has a problem, we are going to give a supplement for that hormone. And now, if it's puberty, relax. No treatment. Just counsel this girl, tell her, no, the periods will stabilize. The periods will stabilize as time goes on. And if they are hormonal contraceptives, if you're on family planning methods that cause irregular menstrual cycles, you know the medicine. Stop the method. Get advised on another method. For example, the non-hormonal contraceptive methods. Use that so that you can have regular cycles. And also, if it is polycystic ovarian syndrome, then you're going to treat polycystic ovarian syndrome. And you know, in one of my videos, when I was discussing with Dr. Ambarach Ijom, we discussed about the treatment of polycystic ovarian syndrome. You know that the metformins and so on, the family planning pills and so on, how we treat polycystic ovarian syndrome. So if it's polycystic ovarian syndrome, treat that. If it's the thyroid disorders, again, treat the thyroid. There are medicines for thyroid, for hypothyroidism, hyperthyroidism, euthyroidism, whatever the thyroid may be, treat the thyroid. Now, there are two very important things which everyone should consider, and that is exercise and diet. I am telling you, several studies have shown that exercise and diet can help you to improve on the regularity of your periods. Therefore, do plenty regular exercise and eat well. What's stopping you from eating greens? Every time you want to be eating chips and chicken with mayonnaise, whatever. You want just those funny fast foods and so on. Fats, meat every time. Please practice eating a good diet. Greens are not bad. Greens are not for villagers. And this is something I also want to talk about in my video here. Most people, when they go to the hotels, they go to the restaurants, they'll ask for food and side dish. And you know what they are meaning by side dish? They want you to put greens as side dish. My friend, you should be taking what you call the side dish as the main dish. The greens should be the main dish so that you can have a proper diet and avoid irregular menstrual cycles. If it's your very first time to watch my channel, please don't forget to subscribe. Press the notification bell so that you can be notified of any important video. And I told you, if you'd like to get in touch with me, go to my website www.druthman.com and make an appointment. We shall be in touch. Please
Ask Dr.